let's talk about this topic of SATA questions, because this has been a major headache for some people. And when we talk about select other apply questions, that is SATA questions, we do not talk about very easy questions in the NCLEX. We are talking about questions that are a bit challenging, and not many people are fans of SATA questions. We have had people thinking that SATA questions may be eliminated from the NCLEX, especially with the new generation NCLEX. But what has happened actually with the new generation NCLEX is that SATA questions have been extended. They are now referred to as extended multiple response questions. So the strategies of answering SATA questions is an important skill for any nurse who intends to pass the NCLEX. And today, in this presentation, we are going to look at 8 proven strategies for answering SATA questions. As well, we are going to practice a SATA question so that we can apply the strategies. So this is a SATA question that we are going to answer. And this question is derived from the topic of documentation, nursing documentation. So I'm going to be explaining how to answer this question and how you arrive at the answers, all right? So let's go ahead and get started. The first point or strategy you need to have is that you must be a master of NCLEX content. Now, what you may realize even as you do SATA questions, you realize that a good majority of SATA questions actually are content oriented. They need you to be a person who has really mastered the nursing content, and in this regard, the NCLEX content, so that you can answer them well. In fact, in your practice, you realize that some of the questions are directly derived from knowledge. I am one person who do not agree with the people who say that NCLEX is not a knowledge exam. To some extent, it is a knowledge exam because you need to know the content. You have to master the content so that you can apply the content even in critical thinking. You cannot apply critical thinking appropriately if you have not mastered the content. So you need to know what is what in nursing, what is what in the NCLEX, so that you can apply your knowledge of the content to come up with the answers. All right? Number 2, you cannot answer an NCLEX SATA question without understanding the question. And many people fail SATA questions because they do not take time to understand the question. How should you understand the question? If it means reading the question twice, then read the question twice. Read it slowly and again read it. Read the options and again read the options. And that is going to help you so much to understand. If you try to answer without understanding the question, then you are likely to fail. Number 3, consider the type of question. Now, there are various types of questions, but some of the most common, especially in SATAs, are positive query questions and negative query questions. So in positive query questions, you look for the good answers. A positive query question is likely to ask you something like, which options show understanding? That is a positive queried question. A negative queried question is likely to be something like, which options show a need for further information, or which options show a need for clarification. All right? So it is important to classify the question, understand whether it needs good answers or it needs bad answers. In that case, do you need to choose the positively stated answers? Do you need to choose the negatively stated answers? Okay? Number 4, one of the problems that people have been having when it comes to answering SATA questions is because they like giving enough options. This is a problem that has been with many people. That you're given a question of 6 responses total, and the answers to that question are only 2, but you feel that 2 are not enough, so you want to add another one so that you can have 50% of the options given as answers. That is a big mistake. So we want you to choose only the good answers, the answers you feel are reasonable enough and logical enough to be answers. Don't choose extra answers. Don't go extra. If you're given a SATA question of 7 options and you feel only 2 are answers, just go with those 2. Don't add. Number 5, relate the options with what is asked. So the question you ask yourself is, which options respond to the question asked? Which options really respond or logically respond to the posed prompt? The prompt in the stem of the question. The information given in the stem of the question is what is going to enable you or to allow you to answer an NCLEX question well. So you don't just look for the good answers, the ones that look like they answer the question well. No. You look for the options that really address the question, address the logic of the question. Your answers must speak to the question. They should not just look good. They should speak to the question. If they are not speaking to what has been asked, they are just good options. They are not answers, so you cannot choose them. All right? Number 6, think about the effect of the response. Now, say for instance, you've been given a patient scenario. You are managing a patient. You need to ask yourself, if I choose this option, what is going to happen to my patient? If I choose this option is going to delay a treatment. The patient is going to die. You don't want to kill a patient because NCLEX is preparing you to be a safe nurse to practice. So even as you choose options, you want to ask yourself, what is going to happen to my patient? And if you realize that something bad is going to happen to your patient, then you cannot choose that option. You're going to choose options that enable you to attend to your patient in a safe manner. Safe options. All right? So you need to ask yourself, what is the effect of that action that you are about to take to the patient? Number 7, what sense does an option make? All right? So you want to understand if you can rephrase that question in terms of true or false. So you look at the option and ask yourself, is it true? Is it false? So first of all, you will have to determine whether you need to choose the true answers or you need to choose the false answers. And this also is going to help you. As well, you can use yes or no. Is it good to do this? Yes. Is it good to do this? No. So you can also use that approach, and it's going to help you to answer SATA questions. Number 8, similar options. Now, upon classifying the question, whether you're using the true-false method or you're using the positive-negative method, you will realize that the answers you choose have some similarities. Sometimes you can realize that the options that should not be chosen, that is those that should be eliminated, have some similarities. So this is a good way of verifying your answers. It's a good way of telling whether your answers rhyme with each other, because when they are all answers, they have something similar with them. It may not apply to all the questions, but in a good number of questions, you find that this actually works. All right? So that's the end of the strategies. Let's now go back to the question and review the question. First of all, we need to understand what the question is asking us. Now, look at that question. The question is asking, the RN is reviewing the principles of documentation with nursing students. The keyword there is principles of documentation. We can call it a key phrase, okay? So when you're doing NCLEX questions, it is very important to understand keywords and key phrases. You must be able to identify them. So then the question prompt asks us, which statements from the nursing students require clarification from the RN? So when we talk about require clarification from the RN, it means this is a negative query question. We are looking for the bad answers. We are looking for the options that should be clarified by the RN. We are looking for the bad options which the RN must correct. In other words, which options should the RN correct? All right? Or which options should the RN give further information about? So number 1, or A, says I should use objective factual language when documenting. That sounds a good answer, and indeed it is, because objective and factual, objective highlighting of the information that should be documented, that is very correct. So we choose that one as an, that is a good answer. So we don't choose that one because the question requires us to choose the bad option. So this is a good option. And according to the question, we are looking for the bad option. So we eliminate that. B says, I should record only the client's complaints and symptoms. This is a bad option because it is talking about only. Sometimes one of the strategies we use in NCLEX, look at the choice of words that have been used in the options. Only is limiting. So when you are assessing a patient as an RN, there are many things that you're looking at. You are doing your own observations, which are not included here because the word only is limiting. So the RN needs to correct this statement and tell the student that when you are documenting, you don't include only the complaints and symptoms. You need to include everything. All right? C, using abbreviations and acronyms as much as possible is encouraged to save time. That again is a bad option because it is not encouraged to use abbreviations. It is not encouraged to use acronyms because the nursing codex is a communication document. It is supposed to communicate to other healthcare providers. So suppose some healthcare providers are not well familiar with the acronyms you are using, then there is going to be gaps in the communication. So that is not encouraged. So this is a bad statement. The RN is going to correct it. So C is part of the answers we are going to choose. D, I will add an addendum to correct errors. Indeed, this is what you're supposed to do. So this is a positive response. It is a good answer. So we are not going to choose that one, because we are looking for the bad answers. Number E, I will correctly use words such as normal and abnormal to correct findings. No, this is a bad option because the RN is supposed to use specific words to collate the findings, not to use general words such as normal and abnormal. F, will be sure to delete and alter entries whenever I make errors. No, this again is a bad option because you're not supposed to delete you're not supposed to delete entries. You're not supposed to alter or change entries. You're supposed to use an addendum. So if you look at D and F, they're actually contradictory to each other. So one of them will be an answer, the other one will not be an answer. So how have we answered this question? We have looked at the type of question we have identified to be a negative query question, and therefore we knew that we are going to look for the bad answers, the incorrect options, and those who are going to be our answers. So the explanation is given here, which I have already done. So at your own time, you can just check that explanation, and it doesn't give any harm. It doesn't do any harm. If you want to make your contribution in the comments, that's very okay. So thank you very much for participating in this exercise. Let's meet in the next video.